Richard Pyatt here. Welcome back to Creating Dementia Solutions. We're a Miles for Memories program, and we're also a podcast. You might be listening to us. You might be seeing us on Access Vision. You might be seeing us on YouTube. However you're finding us, we're glad you did. In fact, follow the Miles for Memories Michigan Facebook page so that you're alerted when these episodes come available, and you can listen, watch, however you're finding us. We've been talking about the Lancet Commission list of factors that we may have some control over, and that is a good thing when it comes to reducing our risk for dementia. T.R. Shaw is back with us here in Battle Creek, an author, a community volunteer, and with the Cereal City Sunrise Rotary. And if you didn't happen to see or hear our last episode about what the Rotary is doing as it relates to diabetes, do that. Have a listen, have a watch, because it's becoming a focus for, at the very least, Cereal City Sunrise Rotary. But this is we expect will catch on, and this will be a focus in terms of education and other things as it relates to diabetes. So welcome back, TR.
Thank you.
So I wonder, as you've looked at this as part of this action group in the Cereal City Sunrise Rotary, have you seen and heard about diabetes connections to dementia at all?
Yes, we have. It's a new area in diabetes that we're just now beginning to understand. First, we have type 1, which is usually what should be called childhood diabetes.
Right.
Type 2 is what used to be called adult onset, but in our day and age, it's getting younger and younger and younger. So they're not. They don't really call it adult onset, but it's kind of what it is in your adult years when you contract it. But and then of course there's gestational diabetes when pregnant women develop it, but that usually goes away. Sometimes it develops into type 2, but it's fairly rare.
That's interesting.
But that's gestational. But now what's being labeled, or it's used by some people now, as type 3 diabetes, which is the connection to Alzheimer's and dementia. When you stop and think that we've known for a long time that high glucose and high in diabetes affects the kidneys, it affects the livers, it affects your nerves and neuropathy and your eyes. The brain is an organ too, and we're now starting to understand the connection between insulin, the glucose, and the effect that it has on the brain. And I'm not an expert on it. There's a lot of research, and it's a lot of debate too on the extent on that, but it's coming along. In fact, University of Michigan is one of the top researchers right now in dementia-related diabetes. Not saying that everybody who develops dementia or Alzheimer's has diabetes, but there is a connection. They're finding that. The more research needs to be done. It's caused by an insulin resistance and insulin-like growth, a dysfunction that occurs specifically in the brain. And I would talk to medical professionals about it on that. But just the fact that it is being developed, it is being researched, and it is being looked at quite seriously now, and then they're finding there's a strong connection to.
Well, and so there you are. It's not a surprise then that when the Lancet Commission says, look, here are the things that you could potentially do to mitigate your risk of dementia, that diabetes shows up on the list. Not a shock. But I think what you've begun to say is managing diabeties
May
is
help
good.
prevent.
Yes.
May help prevent dementia in the future. May. I'm not a professional. So
We just don't know enough yet, do we? Even a professional, a researcher from U of M, let's say, we're sitting here, they probably would be saying the same thing. We don't know enough yet, but we know that we're trying to maintain it.
I pulled up some interesting articles, and this is one that I found that Ozempic, which is right now the miracle drug that's helping people lose weight, and it's also driving down your A1C or your collective sugar. But there's a story about that Ozempic may be linked to lowering the risk of Alzheimer's.
There's been some talk about that, hasn't there?
Semaglutide is the active ingredient in Wegovy may help protect against Alzheimer's disease and people with type 2. So by using that, you may stave off dementia later on. That's inconclusive, but there's a lot of research here and a lot of big words. You know, like I said, I'm not a medical professional.
Well, it would be interesting to know, and I suppose maybe eventually we'll find this out with more research, is that because just managing your diabetes, maybe using Ozempic, is a good thing to begin with?
Right.
Or is there some kind of component of Ozempic or the GLP-1 class of injectables that might have some kind of superpower where dementia is concerned?
That's where we're discovering new things every day. They had a study it was at Case Western, examined 3 years medical records for 1 million people with type 2 diabetes, and they found that they use those people over 60, and patients with obesity. They conducted several target trials, and they did show some improvement in brain activity, because, like I said, the brain is like every other organism. I mean, it's like you have your kidneys, your liver, like that high insulin, beats them up basically.
Yeah.
And so the brain is no different. So, but like I said, we're learning as it's going along. Research is out there and it's coming along. But
and this kind of discussion about some of the new things that might be going on as it relates to understanding diabetes, dementia, or whatever it might be, but certainly diabetes, is part of the action group that the Rotary has inspired in Battle Creek. The notion that you can connect yourself to some of the professionals to whom you refer, who can tell you, look, we're watching this, and here's some other things we've learned. This is part of what's going on. It's constantly evolving, isn't it?
Yeah, it's great. I mean, we're living in a time when the medical world is really making some big strides in a lot of things. But just as far as my own point of view, it just makes sense that if you manage the diabetes and keep yourself, you're healthier, and the brain is healthier too. So that more than likely will affect whether or not. I'm not sure what the root causes of it are. A lot of us, we still don't know on a lot of it. I'm sure. Sherry will probably tell you that too.
Sherry would know, right off the top of her head.
But it's as we find more and more, the healthier you can stay, the better off you are. And I mean, it's all comes down to taking care of yourself and doing that. And I said healthcare, and like I talked about earlier, that a third of all medical expenditures today are diabetes related, in both insurance and medical costs.
Just sit with that for a second. A third of all medical expenses are diabetes related. Now, if you've had a broken arm,
well,
you know what medical expenses are like, even for that. So 1/3 of this massive amount is diabetes related.
Yep. And a lot of these terminal illnesses we have, either it's like kidney failure, even some heart disease is probably an underlying cause by diabetes. So and diabetes doesn't really get. So I was a funeral director for 30 years, and I don't ever recall seeing a death certificate where somebody died of diabetes, but it was like a second or third cause.
It was,
and it stimulates something else, and so that's, if we can take care of that, we can stave off other diseases too.
And maybe dementia would be one of them.
We hope so.
We would hope so. What we do know, and we've said it many times on this program, about mitigating risk of dementia, part of that is movement. The notion that exercise is helpful. Well, I tell you what, diabetes is the same way, right?
Yep.
You hear a lot about that, don't you?
Yep.
Move, exercise.
That's right. It's that's the key factor. It's and just something as simple as walking. I mean, just doing that. I mean, it's just movement in general. If you eat a big meal or you eat something you shouldn't have eaten, just go take a walk. I mean, it's just a lot of times you can do that. But and with the the sensors now, you can know exactly where. If you're high, you go walk and you come back. Oh, it came down.
Yeah, the
So you
glucose
can-
monitoring
Oh my
systems
gosh,
are
it's just
great.
wonderful. I mean, it's just, I'd recommend those to everybody. Matter of fact, there's been some controversy because athletes are wearing them now. So, and
If they're not diabetic.
they're not diabetic,
Yeah.
but it allows somebody to monitor their glucose in a competition. And is this, they're trying to rewrite the rules now. Is that an unfair advantage? Well, like a cyclist, okay, who's, like on like the Tour de France, they can look at it and know whether he's going low or he needs more energy, needs more.
Oh my goodness.
So that's another use of them that they're kind of looking. It was kind of interesting. But
Yeah, it is interesting.
yeah, so
Technology is great, right?
Yeah.
I'm thinking about AI, right?
yeah,
Technology is great, and it can be useful, but sometimes you got to put some guardrails around it,
Right.
right, to keep it in its original intent.
So-
But that is a tremendous thought that we hear about. Miles for Memories, for example, talking about movement programming research in their mission.
sure.
But the movement part always comes up.
Yep.
And it is true with diabetes. And you probably, as part of the action group at the Cereal City Sunrise Rotary, have that as a component,
Yep,
right?
right.
Movement comes up in these discussions.
That's why one of the things when part of our 5 points is a Rotary Club could help build a park and do that for recreation or fund rails to trails or do whatever. That would be part of helping with diabetes, things like that. And so it's, activity-based things that we can do. And,
Well, think about that.
Yep.
That even your mind might not even go all the way there in thinking about
Yeah.
funding a recreational space, but it has an underlying
effect on
Yeah.
health, and that's kind of what fits into our category on doing that too.
Yes.
So
There you are. The notion that managing things that could mitigate your risk of dementia, that's the whole point of that Lancet list. And we'll link that in the show notes with this episode. You can just type it into Google too, Lancet Commission list to mitigate risk of dementia. And that's going to come up. And this was something that was developed years ago, but updated in 2024 to add things like diabetes, which, as you pointed out, are a vast concern as the underlying effects of that and eventuating things that happen are really more significant. So do that. Have a look at that because that will make a difference. And maybe we piqued interest or two from some folks about the idea that Cereal City Sunrise Rotary is looking at this. And if you didn't hear our previous episode, I want to give you a chance to
Sure.
to say it again. You're going to focus on this
Right.
going forward, and that might be of interest to people who might join.
Yep. November is World Diabetes Month, and November 14th is World Diabetes Day. We're going to do some big events around that time. Our club right now is we've been doing with food. We're working with some food pantries, doing healthy food. We've done a few events around that. The club, we're putting together a children's book right now that's hopefully will be used by all of Rotary someday to help kids understand in the elementary level. If there's somebody in your class who has a monitor and has this, he's just as normal as you. This is what it's all about. And this is to educate them that this isn't anything out of the ordinary, and help them do that. And then club is also working. We're in the beginning stages of an international project with a Rotary Club in Mexico right now to do a joint diabetes project with them down there. So.
Well, the book and educating children reminds me very much of the Miles for Memories puppets, right?
Yep.
The way to find an angle that a young person will latch onto and hear this information.
Right.
And I expect that what will happen with this book is what has happened with Miles for Memories, where folks adults start to say, now I get it.
Yeah.
And it makes sense even to the adults. Well, congratulations on
Thank you.
on all the work that you're doing at Rotary TR, and we'll look forward to an update from you sometime
Sounds
about how
good.
things are going.
I think we're in the beginning stages, but it's like anything else, it takes time.
Yep,
And it
that's
takes to raise awareness is usually the biggest step in doing anything.
And we're climbing that step.
Yep, that's right.
T.R. Shaw on Creating Dementia Solutions, and we appreciate you being here as well as perhaps you found us on Access Vision or YouTube or as a podcast or Miles for Memories. Miles for Memories has a Facebook page, and if you click the like on that, you'll get alerted when these episodes come available. Thanks for being with us on Creating Dementia Solutions. Richard Pyatt, take care.